Good afternoon, Mr. Luganville. My name is Erica, and I'm a nursing student with Tulsa Community College, and I'll be doing your assessment today. Is that okay with you?
Yes, that's fantastic.
Okay, I'm going to go ahead and go wash my hands and put some gloves on, and I'll be right back.
Okay,
So are you doing okay today?
doing pretty good.
Okay, good deal. I'm asking these questions to help verify the patient can hear me okay. This is my first sign of testing his hearing. And then what I'm going to do is I'm going to go ahead and I will be taking your vital signs. I will be listening to your heart and your lungs, and I'll be checking your tummy out, okay?
Okay,
Okay, so what I'm going to do first is I'm going to go ahead and I'm going to take your blood pressure, okay? And what does your blood pressure normally run?
120 over 80.
Perfect. Okay, that's what I'm getting right now. That is good. I'm going to go ahead and take your temperature. Wonderful. Okay, I'm going to go ahead and have you just lay your arm down. I'm going to take your pulse. And while I'm doing this, I'm going to count his respirations and not let him know that I'm doing it, so he doesn't start noticing his breathing on his own. Okay, I have got your pulse. Okay, and what I'm going to do first is I'm going to take a look at your head and make sure everything is symmetrical. Make sure you don't have any lesions or bruising. I'm going to make sure that your hair distribution is how it should be. Now I'm going to go ahead and take a feel of your neck. Okay, feels good. And I'm going to go ahead and just kind of check his pulse. And I'll only do one side. That feels excellent. Okay, I'm going to go ahead and do your pulse ox while I'm here. Okay, oxygen's good. Okay, and then what I am going to do is, do you have any pain today?
No.
Okay, good deal. And if he did have pain, I would ask him to rate it on a scale of 1 to 10, which he has no pain, so we're good there. Okay, and I'm going to go ahead and take a look at your eyes. Do you wear contacts?
No.
Okay, have you had any procedures done?
Yes, I've had lens replacement.
Okay, wonderful. If you would, go ahead and follow this pen without moving your head. Just use your eyes. Okay, it looks like his eyes are functioning as they should be. And I'm going to go ahead and take a look in his ears and check for any moisture or redness. And those look good. Okay, if you would open your mouth for me and stick out your tongue. Okay, everything looks pink and moist in there. And if you tilt your head back so I can take a look in your nose, all looks good there as well. Okay, and I've already felt your neck, so we're good there. There was no swelling. Okay, what I'm going to do now is I'm going to take a look at your arms and your fingernails. I'm going to check for lesions or bruising. I don't see anything here or there. Okay, I'm going to check your fingernails. At the same time, I'm going to check for his capillary refill. Everything looks good. Okay, and what I'm going to do now is I'm going to take a look at your lungs. Have you had any cough lately?
No.
Okay. Oops. Okay. And what I need for you to do is take a deep breath in through your mouth and through your nose, in through your mouth and out through your mouth. Okay, again. Okay, again. Again. Okay. Again. Okay, again. Again. Okay, again. Again. Okay. And again. And of course I would have him unclothed at the time if it was an actual assessment. I'm going to go ahead and take a listen to your lungs back here. And again. And again. Okay. Okay. And again. Okay, and again. And again. And 2 more times and you'll be good. Okay. And his lungs are clear to auscultation. Okay. And now I'm going to go ahead and inspect your abdomen and your chest. Everything looks good. I don't see any lesions or bruising. I'm going to take a look at your back as well. I don't notice any, I do see some scars. Have you had surgeries in the past?
Yes.
And what kind of surgeries?
Fusion surgery.
Okay, on your back, your spine?
Yes, lower
Okay.
back.
Wonderful. Go ahead and notate that I found scars there regarding his surgery. Okay, now I'm going to take a listen to your heart. Okay. I'm first going to check his aortic. Everything sounds good there. Then I'm going to move over to the pulmonic. Okay, then I'm going to go down to herbs. Then I'm going to take a listen to his tricuspid. And then down to the apex. Everything sounds good. Okay, and I'm going to go ahead and check your pulses as well. That was good. I checked your radial pulse earlier. I would check his femoral pulse. Then I'm going to check behind his knee. And then I will also check his pulse on the top of his foot, which is the dorsal pedis, and then also his posterior tibial, which is on his foot. He's got shoes on at this moment, so. Okay, and I'm going to go ahead too, and I'm going to inspect your abdomen and see if I see any bruising or any scars. All that looks good. And I'm going to go ahead and take a listen to your tummy. I'm going to auscultate first. And I'm going to start up at the upper right quadrant. Then I'm going to go down to his lower right quadrant. I'm going to go over to his left lower quadrant. And then up to his left upper quadrant. All sounds are normal. I don't hear any hyper or any hypo sounds. Okay. And now I'm going to take a look at your legs and your feet and see if I notice any scars or if hair distribution is good. There's no lesions or bruising. Everything feels good. I don't notice any edema on his legs. His feet and his toenails look good. He's been groomed. I don't notice any edema or any swelling in his feet either. Do you happen to get any leg cramps at all?
Sometimes in the summer.
Sometimes just dehydration?
Yes.
Okay. Does it usually get fixed upon drinking water and resting?
Yes.
Does it go away? Wonderful. Okay. Well, it looks like everything is good. Do you have any questions for me while I'm here?
No, I'm good. Thanks.
Okay, wonderful. Thank you for coming in. If you have any questions, feel free to give us a call.
Okay.
Thank you.
Thank you.